I'm a co-founder and CEO of TAP Elder Women's Wisdom for Youth. Most of my introduction will be made in the presentation, but basically is what I can say at the moment, that I'm just excited to be here today and share with you what we are doing, because I feel like as an elder person, I feel there's a lot to learn and a lot to share with others. Thank you.
Thank you. My name is Neema Tembele. I'm Tewi's other founder, and I am really excited. We're very honored to share this space at Musquatch's Cultural College's micro-learning series, and just excited to be here and discuss and learn and share what we do with all of you. Thank you. Mama Rustica will start the presentation.
Excuse me. Okay, so do I start the presentation?
Yes, please hold on just 1 second while I share the presentation.
Okay, thank you.
Please go ahead, Mama Rustica.
Thank you. Okay. Hello, everyone. Welcome to today's presentation on building mental health resilience by tapping in elder wisdom. We are delighted to be here today at Musquatch's Cultural College's micro-learning series, and are so happy to see such an enthusiastic group here today. We want to express our gratitude for the invitation and to thank all of you for your presence and sharing this space with us. Over the next 15 minutes or so, we will explore the powerful role that elder wisdom plays in enhancing our mental health resilience. So let's dive in. I'm Rustica Tembele, co-founder and chief executive officer of TAP Elder Women's Wisdom for Youth. I'm retired, I'm not tired, and certainly not done affecting positive change and creating social impact in our Tanzania communities. A little housekeeping before we get into the weeds. Please keep your mics muted during the presentation. Use the chat to introduce yourself and where you are joining us from today in the chat. Feel free to use the reactions during the presentation. We will answer questions shared in the chat or asked during the live question and answers after the presentation. And without further ado, let's get started.
Please hold on just 1 second. I realized I was sharing the wrong screen. My apologies.
Oh. Okay.
1 second.
Do I have to start again?
No, just 1 second, please.
Okay.
Please proceed.
Thank you. I think I've done with the friendly reminders that I did. So now let me go straight to the topic. Welcome to, TAP Elder Women's Wisdom for Youth, or TEWI, is a non-profit organization in Tanzania. Our mission is to bridge the intergenerational and mental health treatment gaps. We train elder women in WHO's Mental Health Gap Action Program, The elder women provide free mental health services, psychosocial support, and psychoeducation resources in collaborate with the schools to train us in evidence-based mental and behavioral health interventions and integrate mental health literacy into their curricula. And we partner with the public sector and diverse peer-led grassroots organizations to plan, design, develop, and integrate equitable mental health care into their services. Today, we will talk about the significance of mental health resilience and discuss the role elder women in Tanzania play in supporting communities to enhance mental health resilience by bridging the intergenerational and mental health treatment gaps. We'll examine practical strategies for tapping into elder wisdom and discuss the need for creating supportive environments and promoting intergenerational collaboration. We will also highlight the importance of providing evidence-based resources and support for mental health. So, what do we mean by mental health resilience, and what roles do intergenerational connections play in building resilience? Mental health resilience is crucial for individuals of all ages as we face various challenges in our lives. Stress, anxiety, and depression are common mental health issues that many of us encounter. Resilience, the ability to adapt and bounce back from adversity, plays a vital role in maintaining our well-being. It empowers us to face life's difficulties head-on and find ways to navigate through them successfully. Intergenerational connections play a vital role in enhancing our resilience. By building bridges between different generations, we foster a sense of unity and create a supportive community. According to WHO, 1 in 7 youth and adolescents aged 10 to 19 years old experience a mental health disorder. Depression, anxiety, and behavioral disorders are among the leading causes of illness and disability among adolescents. Failing to address adolescent and youth mental health conditions may impair both physical and mental health and limit opportunities to lead fulfilling lives as adults. In Tanzania, youth and adolescents under 25 make up the majority in a country with a population of over 67 million. Our current healthcare system is simply overwhelmed by these numbers, relying solely on specialists to provide service for people affected by mental, behavioral, and substance use conditions would prevent millions of people from accessing the care they need. And so, our innovative approach of tapping into elder women's wisdom to bridge the intergenerational and mental health treatment gaps was born. To tap into elder women's wisdom, let's explore some practical strategies. First and foremost, active listening and engaging in conversations with older adults is crucial. Take the time to truly listen and learn from their experiences. Seek guidance and advice from them when facing challenges. Additionally, consider participating in intergenerational programs and activities that provide opportunities for meaningful interactions and the exchange of wisdom. Meaningful interactions between the young and the elderly enable mutual learning. We can share our perspectives experiences support one another, leading to a stronger and more resilient community as a whole. TEWI creates inclusive spaces that effectively of elder women, which manifests outwardly in the form of exceptional advice giving, decision-making, and problem-solving capacities. By a show of hands, using the reactions feature or typing 1 in the chat, how many of us maintain relationships across generations, not including your immediate grand relatives, of course? Well, as a retired elder woman, I experienced firsthand the lack of inclusion and engagement of the elder population. In Tanzania, this may be accounted for mostly due to social arrangements that are unsuited for addressing the aging population's concerns. Our programs tap into the wisdom of elder women gained from life experience, self-reflection, and training. I know there was a question yesterday. We saw the question. Someone asked this question. Yeah, our programs tap into wisdom of elder women gained from life experience, self-reflection, and training to provide mental health care and psychosocial support. Mental health and psychosocial support includes any support that people receive to protect or promote their mental health and psychosocial well-being. We have adapted WHO's mental health gap action program to align with the Tanzanian culture and context. Trained elder women provide interpersonal counseling, facilitate group talk therapy, and build life skills through the stories they tell, which we publish in a storytelling and sharing life experiences are powerful tools for cultivating resilience. By encouraging elderly individuals to share their stories, we promote understanding and empathy across generations. Listening to their narratives allows us to gain valuable insights and lessons that can enhance our own resilience. We can learn from their successes, challenges, and wisdom, incorporating those lessons into our own lives. When I was growing up, a child was everyone's child. The responsibility of every adult in the community and support systems existed among people and families within the community. I remember the stories that my grandma used to tell us. Every time she told a story, her face was glowing with joy. That was a bonding moment and an opportunity to learn from her about the stories she was telling us, all seated by the fireside. Now that has faded with development, replaced by technology and gadgets. These are our heroes, the elder women, using storytelling to teach life skills and bridging gaps by providing intergenerational mentoring, among other mental health services and psychosocial support programs we offer in under-resourced and marginalized Tanzanian communities. Intergenerational mentoring is another wonderful way to tap into elder wisdom. By establishing mentorship relationships with older adults, we can foster resilience in ourselves. Learning from their experiences and perspectives allows us to gain new insights and strategies for navigating life's challenges, because we all have life's challenges. Mentoring relationships provide guidance, support, and wisdom that can significantly contribute to our mental health resilience. I would like to share with you a story about one of our constituents who we were fortunate enough to continue following up with beyond the project. As a matter of fact, our funder for the pilot project, Voice, invited a member of our team and our project's direct a constituent to a learning in Daba, where we took a deep dive in 3 themes: intergenerational learning, leadership development, and the persisting lack of implementation of existing laws and policies. The constituent I went with shared an incredible story that was truly inspiring. We shall call him Mr. X for his privacy and protection. Mr. X shared a story about his personal life. He was married, had a child. After some months, the child died. And with no time also, the wife died. Mr. X was so devastated to the extent that life didn't mean anything to him. He really wanted to commit suicide because he didn't see the value in life. But fortunately, he meets this one of our she heroes, and she gives him psychosocial counseling to the extent that now Mr. X has really changed. He has accepted the loss, and now he's moving on with his life, and he's started business, and he plans to get married in the near future. And now let's talk about why creating supportive environments is essential for promoting overall well-being and fostering positive growth and development. Again, by a show of hands, using the reactions feature or typing 1 in the chat, how many of us feel our environment can be conducive to our behavioral, mental, and physical growth? Whether in schools, workplaces, communities, colleges, or families, a supportive environment has a ripple effect on the individuals' lives, leading to improved mental and physical health, increased productivity, stronger relationships, and a more inclusive society. We need inclusive communities that value and celebrate the wisdom of older adults and recognize the unique contributions each generation brings. Creating supportive environments fosters inclusivity and diversity. In such environments, people from diverse backgrounds feel welcomed and valued, leading to increased cultural understanding and appreciation. Embracing diversity enriches our perspectives and strengthens our communities. It's also essential to provide evidence-based resources and support for mental health within our communities, ensuring that individuals of all ages have the tools they need to thrive. TEWI partnered with the Tandale Youth Development Center to answer questions about mental health that were asked by youth and the community. We published the questions and answers in a booklet that has been distributed to various stakeholders after being, of course, validated by specialists from the Ministry of Health. The booklet was developed and disseminated countrywide, such as to higher learning institutions, all regional libraries, civil society organizations, faith-based groups, and to individuals as well. A free Swahili copy can be downloaded already on our website. It is inspiring now to see people talking about mental health on many different platforms. One of the key lessons from the resource development session is that there are still a lot of fundamental questions that remain unanswered for many young people. The development session of the booklet provided our team, TEWI's team, the perfect opportunity to collaborate with specialists to answer some of the key questions about mental health, especially on those issues specific to understanding what mental health is, understanding the relationship between substance use and mental health, and many other questions. Supportive environments play a crucial role in building resilience. When individuals face challenges or setbacks in a supportive setting, they are more likely to bounce back, learn from their experiences, and develop the ability to adapt and grow. Resilience is a variable trait that helps individuals navigate life's ups and downs effectively. The mental health crisis affects all of us in some way. Our approach focuses on youth and grassroots communities. And on that note, let's take a look at TEWI's community-based mental health care and psychosocial support programs and how we enhance referral systems and community linkages to public healthy care pathways. Mental health is integral. There is no health without mental health. When we are mentally healthy, we can realize our abilities, cope with stress, work productively, and contribute to society. In our pilot project, we partnered with 15 public health institutions in a one-year project to integrate mental health care and psychosocial support within public health institutions. The elder women reached 2,330 people stationed within the hospitals, health centers, and dispensaries before we had to stop the service due to the corona pandemic. In 2021, we collaborated with 15 local government authorities to integrate mental health care and provided psychosocial support to over 1,600 people in less than 4 months. And my colleague will share about progress made in the 2 months since we launched the school-based mental health literacy project. We also provide referrals for general health care or further mental health treatment, as well as links to social and community services through our strategic partnerships. Elder women assess for depression, anxiety, and substance use using clinically validated tools. Based on the assessment and conversation, we may refer the client for further care. Symptoms of depression are often a transient reaction to life stress. Many clients do not require sustained treatment, and the symptoms will remit after 3 to 5 or even fewer sessions. Other clients, however, may require watchful waiting, and a small number may acquire sustained treatment with medication, longer psychotherapy, or both. The elder women, I repeat, the elder women are the first line of defense for prevention and treatment of mental health and substance use conditions. Don't overlook this. Thank you so much for listening to me. I hope that was enlightening. My co-founder will discuss in more detail about TEWI's elder-led programs in youth, mental, and behavioral health and substance use conditions. Once again, thank you very much for this opportunity. I am passing over to Neema.
Yeah, thank you, Mama Rustica. Please give me just a second as I share my screen. Hello, hello. Again. Thank you for staying with us as we continue with today's presentation on building mental health resilience by tapping into elderly wisdom. We are honored to share this space with you in Musquatch's Cultural College's Microlearning series. We'll continue exploring the powerful role that elderly wisdom plays in enhancing our mental health resilience. Let's dive in. Again, my name is Neema Tembele. I'm TEWI's other founder and the Director of Development and Operations. I'll talk a little more about how TAP Elderly Women's Wisdom for Youth taps into elderly women's wisdom in its mental health care and psychosocial support programs. To kick us off, let's take a look at how TEWI partners with schools and peer-led grassroots organizations in integrating mental health literacy, mental health care, and psychosocial support into school curricula and existing partner programs. One major component of mental health and psychosocial support is the treatment and prevention of psychiatric disorders such as depression, anxiety, post-traumatic stress disorder, and substance abuse. Mental health and substance use conditions impose an enormous burden of disease that leads to premature mortality and affects functioning and the quality of life. Elders, who are so often disregarded in today's technologically advanced society, have a wealth of knowledge about the world that younger generations could benefit from. Some of our elders have seen firsthand what we read about in history books. That's pretty exciting. They have a plethora of experiences with fascinating stories to share. So, how does TEWI play its role in ensuring that students and communities have access to mental health care, psychoeducation resources, and the support they need? And this brings me to my question for all of you. By a show of hands, using the reactions feature in Zoom or typing 1 in the chat, how many were taught mental health literacy in school at either primary or public school or secondary school level? Great. And a follow-up question. How many received? Oh, well, none. The follow-up question was going to be how many received this education from a public school? Okay, fantastic. Thank you for sharing that. While Tanzania is implementing a national mental health policy, teaching mental health literacy is currently not in primary or secondary schools curricula. According to WHO, students spend 15,000 hours at school from kindergarten to finish. When teachers feel better equipped to support student mental health, it's easier for them to manage difficult classroom behavior and promote students' academic success. Untreated or inadequately treated mental illness can lead to high rates of school dropout, unemployment, substance use, arrest, incarceration, and early death. TEWI has adapted WHO's school mental health program and a mental health literacy curriculum guide developed by Teen Mental Health Literacy, a nonprofit organization in Canada. Sony Music Group funded this one-year project, which launched in June 2023. We partnered with the Mental Health Association of Tanzania, also known as MEHATA, to develop a mental health literacy curriculum guide and train teachers and student mental health ambassadors. Our objectives are to improve mental health literacy outcomes in schools and provide evidence and school-based mental and behavioral health interventions, to strengthen peer support systems and student and teacher linkages to community and public healthcare pathways, and to advocate for policy and budget change to integrate mental health literacy into school curricula. We've trained 40 teachers to support the mental health needs of 1,280 students. We've also trained 14 students to be mental health ambassadors, with responsibilities ranging from providing support to fellow students to promoting mental health in the school. The project concurrently trained 7 elderly women in youth and adolescent mental health care. Collaborating with the local government authority in the school's ward, the elderly women have already facilitated over 30 interpersonal counseling sessions since July during weekly community-based interventions. July of 2023. So why teach mental health literacy in school? Mental health literacy enhances student well-being, which positively impacts academic performance. When students have the knowledge and skills to manage their mental health, they're more likely to be engaged in their learning and perform better academically. Additionally, fostering a supportive school climate that prioritizes mental health reduces absenteeism, discipline issues, and bullying, creates a conducive environment for learning. Incorporating mental health into the curriculum empowers students by promoting self-care and self-management strategies. They learn various coping mechanisms, stress reduction techniques, and strategies to promote resilience and positive mental well-being. Equipped with these skills, students are better prepared to navigate challenges and cope with stressors effectively. School-based interventions allow for the identification and mitigation of risk factors that contribute to mental health issues. By providing screenings, assessments, and educational programs, schools can identify students who may be at risk and provide the necessary interventions, such as counseling or referrals to external mental health care systems. This proactive approach can help prevent the escalation of mental health conditions and promote overall well-being. As we implement the school-based mental health literacy project, tapping into the wisdom of elders is of paramount importance in building student mental health resilience. Elders, like we know, possess a wealth of life experience and knowledge gained through navigating various challenges over the years. Their accumulated wisdom can provide valuable insights and coping strategies to young students, especially during difficult times. Engaging in intergenerational interactions fosters a sense of belonging and connection, promoting emotional well-being and resilience among students. The guidance and support offered by elders can help students build emotional intelligence, develop coping mechanisms, and foster a positive outlook on life. Furthermore, the shared stories of overcoming adversity from older generations can inspire hope and determination in students, enabling them to face life's challenges with greater strength and resilience. One of the primary objectives of this project is to enhance students' protective factors and support systems within the school and in the community. We are incorporating the wisdom of elders into school mental health programs to also promote a sense of cultural continuity and community. Older generations often carry unique cultural experiences and traditions that have been passed down through generations. Integrating these cultural elements into mental health resilience initiatives helps students develop a strong sense of identity and belonging, fostering a more profound understanding of their heritage and personal strengths. Additionally, the mutual exchange between generations encourages empathy and mutual respect, breaking down age-related stereotypes and enhancing social cohesion within the community. Overall, drawing upon the wisdom of elders can significantly enhance student mental health resilience, contributing to a healthier and more connected future generation. Through their experiences, the elderly can offer unique insights into mental health challenges faced by individuals with substance use conditions, which helps tailor mental health care and psychosocial support interventions integrated into harm reduction programs. This intergenerational collaboration challenges the notion that older individuals are passive recipients of care and instead positions them as active agents of change. Involving the elderly in designing and planning mental health care and psychosocial support integration fosters a sense of purpose, belonging, and social connectedness among the older generation, potentially reducing feelings of isolation and loneliness. The ripple effects of their involvement extends beyond immediate constituents, as it empowers older adults to play an active role in shaping policies and programs that have a positive impact on society as a whole. This creates a powerful and mutually beneficial dynamic that enriches the lives of all involved while creating more effective and inclusive support systems for those struggling with substance use conditions. People with substance use conditions often experience co-occurring mental health issues such as anxiety, depression, or trauma. Integrating mental health care within harm reduction services is crucial to provide comprehensive support. This may involve screening and assessment for mental health conditions, interpersonal counseling or group talk therapy, and crisis intervention services. How many of us are familiar with harm reduction programs? Please raise your hand or type 1 in the chat. Fantastic. Thank you for sharing. Harm reduction refers to policies, programs, and practices that aim to minimize the negative health, social, and legal impacts associated with drug use and drug policies and laws. It encompasses a range of health and social services and practices, including, but not limited to, opioid agonist therapy, such as methadone programs, needle and syringe programs, and testing for sexually transmitted infections, such as HIV and hepatitis C, particularly for intravenous drug users. Harm reduction emphasizes engaging directly with people who use drugs to prevent overdose and infectious disease transmission. In addition to mental health care, psychosocial support is essential for addressing the social and environmental factors that contribute to substance abuse. We are creating a multidimensional approach that addresses the complex needs of youth with substance use conditions in Tanzania. This comprehensive model promotes harm reduction, fosters well-being, and supports sustainable recovery. TEWI partnered with 2 harm reduction peer-led organizations, Youth Volunteers Against Risky Behavior, or YOVARIBE, and Peer-to-Peer Supporting Group, to design and plan the integration of mental health care and psychosocial support into harm reduction programs in Tanzania. Our partners had already identified the gap and need for integrating mental health care. We drew some inspiration from one of our initiatives, the Healing Hands Project, that promotes self-care, wellness, financial literacy, and trade skill development. Elderly women will provide counseling, coaching, and support the youth in opening and maintaining savings accounts. So, what's next for TEWI and why? Our audacious idea is to train 4,000 elderly women and scale community-based mental health care and psychosocial support programs virtually and in person across all wards in Tanzania. According to WHO's 2022 Mental Health Atlas, Tanzania currently has an estimated 760 mental health professionals, serving a population of over 63 million. Tanzania is experiencing high incidences of suicides, significantly among adolescents and youth, contributing to the 77% of global suicides in 2019 in low and middle income countries. Also, untreated mental, neurological, and substance use conditions are estimated to account for more than 10 billion days of lost work annually, equivalent to $1 trillion US. Investing in the mental health of youth has a long-term impact on the ability to have a productive and skilled workforce in the development of a middle-income country like Tanzania. Our other grand idea is to facilitate an annual mental health promotion and suicide awareness campaign in person and on different online platforms. The campaign will serve as a powerful platform to raise awareness about mental health issues, reduce stigma surrounding mental illness, and promote early intervention and help-seeking behaviors. By dedicating a specific time each year to focus on mental health, this campaign will create a collective momentum and draw attention to the importance of mental well-being. It will encourage open conversations about mental health, providing a safe space for people to share their experiences and seek support. As a result, more individuals may feel empowered to address their mental health concerns and access appropriate resources and services, leading to improved overall mental well-being. This campaign will also feature a Mount Kilimanjaro charity climb to raise suicide awareness and fundraise for community-based mental health care and psychosocial support programs. Disseminating information about suicide prevention strategies, risk factors, and warning signs equips the public with the knowledge and tools to identify and support individuals at risk of suicide. It promotes community engagement and mobilization, encouraging people to look out for one another and offer help to those in distress. The annual recurrence of the campaign reinforces the message, ensuring that mental health and suicide awareness remain at the forefront of public consciousness and policy discussions. Through its collective impact, the campaign will contribute to reducing suicide rates, fostering a more compassionate and supportive society, and ultimately saving lives. We thank you for welcoming us and sharing this space with Tewi today. I would like to invite you all to get involved in our elder-led mental health initiatives in Tanzania. We look forward to the discussion and answering any questions that have already been posed or may have risen during the presentation. Thank you.
Thank you so much, Nima and Mama Rustica, for your presentations. We really appreciate it. We hope you can share your toolkits which you have developed. The conversation we began before the presentation. We have a question. Do you pay your elders? Like, how do you compensate your elders, the elderly woman?
So we do not provide, it's not a salaried position. Basically, it's more of a volunteer on them, but we make sure that we provide them with a transportation allowance and something for refreshments during the day. So that is what we budget for. We hope to be able to increase that, but at the moment, that's the way it's set up.
You mentioned the program Train the Teachers.
Yes.
So do the elderly women also work with teachers as well as students also in schools?
The training took place in school. They were trained together, but the elderly women provide services from the local government office in the school's ward. So teachers and students have access to them. They've already met, they've attended these trainings together, so they know they can reach out to them in case they need support. But the women during the project will not be stationed in the school. They will be in the local government authority where everybody from the community goes to for whatever issues there may be within the society. Does that answer your question? Yes,
so this means that you are using the public space. Your partnership is for the space. You don't need a separate mental health office or your branches. You're using the current infrastructure, the government space, which is open to everyone in the community. It's sort of like a municipality or a village or a public place. The space is available. Which is good because you can focus on the training and not worry about infrastructure. By partnering, people are already there, and it saves your facility infrastructure costs.
And also, I mentioned very briefly, we have a Healing Hands project. It involves trade skill. When we implemented this project last year in July, we had an elderly woman positioned at our Tewi office. We feared, or what we learned from having the women positioned from the office, which is a non-mental health organization, might have deterred people from coming to seek care there. And after trying that for 2 months, we reached back to our public partners, the public sector partner, and asked to be stationed for when we are operating within the organization's ward, to be stationed in their office, because it will definitely reduce stigma. People go there for various reasons, not just mental health care. So we, like in this, it's been a month since we've started, we've already seen over 30 people, whereas when we were implementing the Healing Hands project for 2 months, we did not get a single person who came to get care or counseling at the office.
Thank you, Nima, for answering question about space and more than space. George has a comment and a question in the chat. It sounds like respect for and openness to elders is well built into Tanzanian culture, which is a strength of the program. Are there any ground rules you have established to protect this strength, or any understandings you might want to establish for communities that struggle in this area?
To protect the strength of elders, of respect towards elders in Tanzania?
George, go ahead. George, you can unmute and clarify.
Yes, that's what I was thinking about. It seems to me that in order for the program to work, there has to be like a ground rule or an understanding that there is respect for one's elders, and I just was wondering whether you do anything to protect that, or you have any recommendations if that's not a strength in your community.
So respect for elders is very much embedded in our culture and traditions. And while in recent years, there's definitely been a disconnect between the generations, we've been fortunate enough where we still respect our elders, while we may not engage with them as much. So there aren't any rules, but I'm glad that you brought that up, because that is something that we should consider in case of an event where the elders are not treated with the same respect as they used to in implementing these services. So that's definitely something else that we'll look into. I am not sure if Mama Rustica has something to share on that. But in Tanzania's culture, respect for elders is at the very top for a lot of young people growing up.
I think that's a great thing, and thank you. That helps answer the question just by stating that. So I appreciate that.
Thank you.
What are the challenges you faced in implementing your different projects? You know, like train the trainer or mental health training for teachers. Then you are running also like harm reduction programs you mentioned. You know, then the coping with suicide programs, you know. And fourth is Mama Rustica shared a story how someone's spouse had passed away and social psychological support was given. So what are the challenges you face because you're doing so many different types of programs?
The challenges we face, the biggest challenge that we face is funding. Securing funding for the different projects has been an issue. I will start with the harm reduction project. That is a project that we and our partners at this point plan to fundraise for, but we are exploring writing grant proposals as a consortium. For the community-based projects, again, funding is an issue. The suicide reduction program or suicide awareness program is built into our mental health care and psychosocial support. And Mama Rustica can share more about Mr. X's experience. But the other challenge that we definitely faced is the mental health stigma and people not being able to come to our offices to seek care or to get the support that they needed. During those 2 months, we went out into the community and did a survey asking people if they were familiar or if they were aware of the programs that we were implementing as we are stationed in that community, and what may prevent them from getting care. And we're still at that stage. This is a survey that is ongoing, but I'm not sure if a lot of people are willing or open to come to a location that is specifically for mental health issues because of the stigma in the society. Evidence of that is in 1 month, those are, 1 month, about five separate days, we were able to see 30 people, as opposed to 2 months where we saw nobody come to get support from the office. So I guess in a way with that challenge, we do have a solution because we have a great working relationship and partnership with the public sector, where we can be positioned in public health institutions when people go to hospitals or dispensaries or health centers to get care, or in the local government authority within the MTA or within the municipality, within the ward.
So who's doing the appointments or referrals, or is it just like drop-in when the services you are providing in partnership with public sector?
The elderly women, like specifically, let's talk about the school project. The elderly women will provide referrals to, we have a local hospital that we are partnering with in this project as well, called Palestina Hospital. And in our previous projects, when people were referred for additional care, that was the other challenge I should have mentioned. They were unable to get that care because of insurance issues, or sometimes they have to pay out of pocket, and people did not have those funds to pay out of pocket. For this school project, we are collaborating with a local hospital that is within walking distance of the school. And when students get referrals, whether from the teachers or from the elderly women, when they see them in the communities, they get referred to that hospital. They do not have to pay anything. Whether they're insured or not, their care is guaranteed. So that's one of the advantages of having a very supportive public health institution to work with us to resolve some of those issues.
I think that's really excellent. Not only do you have the space, but you are also partnered for the, for the service. That's really good.
Yes, continuity of care was a little bit of a challenge.
So apart from funding, what else is your major challenge?
The major challenge is we're a small nonprofit organization, and we don't always have all the human resources to reach as many people, to impact all the people that we want to. From different areas of operations, from marketing, from raising public awareness, that has become very, very challenging for us to be able to do everything and partner with our strategic partners to develop these programs. So human resources we need support in the human resources sector. So we're always looking and hoping to get volunteers who are passionate about this work that can help us reach more people. We have strong partnerships with organizations that already exist in the country doing amazing work. We believe that mental health is integral. We are all affected by mental health, no matter what your work is in. So we partner with all these different organizations for people who use drugs or different communities that are under-resourced, people with different abilities and things like that, to ensure that our programs are built into their existing programs. So human resources, getting support in that area would certainly help us get the load off to allow us to do some of the work that we need to do on the ground and still be able to reach people throughout the country as we want to scale these services across the country.
Nima, you mentioned beautifully our programs are built into their programs, which is really fantastic, because if your services are weaved into your partners' program services or their needs, then you can tap into more resources, whether it is human resources. You've already used space. So how do you do this, like, call for partners? What is your success in building your programs in their programs? Because this is a partnership question.
Yes. What is our success rate? So we have started small. We started with exploring a program with the harm reduction, our harm reduction partners. And this is a program that we've been building, and we'll start fundraising for it soon. But of course, we have familiarity with harm reduction programs, with Mama Rustica's experience from her days as a director of a national response at the Tanzania Commission for AIDS. So in our 10-year strategic partnership, strategic plan, we have identified different groups that we certainly want to work with in integrating mental health care into those programs. For right now, we're starting with the harm reduction organizations and are working up a strategy to fundraise for those programs to start implementing them for their constituents, for their existing constituents. And for example, these two organizations wanted a project that will teach people who use drugs, who are on the methadone treatment plan, how to make chalk. This is something that they had already previously explored. And when we came in, they were like, you know what? Yes, definitely mental health care, especially when you have a person who you refer to for testing, and now they're in this position where they need the support, whatever the results may be. It's a very, very stressful situation. So with those two organizations, we are planning to fundraise for the project and slowly work up to the other identified partners that we have started communications with, but the projects are not fully designed yet. It's still just a collaboration where we communicate and plan together as we see how we may be able to fund the initiatives. I'm not sure if that answers your question.
Yes, it does. And thank you, Nima, because this partnership collaboration has to be authentic. It's not just where there's too much demand for your services, like you don't want to kill your success because you've been so successful, and the need is there so much, which you want to serve everyone. But at the same time, you mentioned that, we are small organizations, nonprofit, and we are working over capacity, like even to amplify it. Training needs to be there. You need some resources, and when people are there for the training, you need space, food, transportation. That would help. Those are all costs when you do the training. I think This is excellent conversation which we had, the dialogue. I'd like to invite the participants if you'd like to pose more questions.